I should say I don't use it as first line. So um, brolucizumab, or Beovu, was the latest drug to be released and approved by the FDA for the treatment of neovascular wet AMD. And the unique design of the drug is that the molecule size of the biologic is extremely small, so you could fit an extremely high dose in a small volume. With that high molar concentration, you can inhibit the activity of VEGF a much higher degree than we previously could. And as retina specialists, we've been spoiled with a very, very low rate of inflammation with treatment as a side effect. And Beovu, after its release, showed a rare but sometimes irreversible inflammatory event that could cause irreversible vision loss in patients. And so there have been numerous investigations into the exact frequency and risk factors for the development of this rare complication. And in my practice, I use Beovu for patients that are failing treatment with monthly injections of the 3 currently available drugs that we have. And so for me, that's a very small percentage. The drugs that we have work fairly well. And for me personally, to take an extra risk for drugs that are working well in patients, or for patients that are, I should say, experiencing an adequate benefit from the drugs that we're currently using, the risk benefit's not there. But there are a small handful of patients that I think could benefit and do benefit from the use of Beovu. As we learn more about the risk factors and perhaps some biologic markers that we could learn about or pre-test patients for, there may be more adaptation of this medication in the retinal world. But I think we are very much highly biased towards something that's safer over something that may be slightly more effective than what we have. And that's kind of where I think most retina specialists stand.